Hello and welcome back. This is my presentation on vitamin D, K2, and COVID, and how these two vitamins can interplay with one another to not only improve a large variety of different health states, but together they can also help to reduce the morbidity and mortality from COVID. It can also be kind of thought as the missing link because not taking enough of this vitamin will not yield the health benefits that can have at greater dosages of vitamin D. So this will be a re-recording because my first one had audio issues, and this is the second part of the lecture series, with the second part to be announced later. So when you're in the sun and the sun hits your skin, that's that's off a biochemical reaction in your skin that makes vitamin D. Vitamin D then goes to your liver to be hydroxylated, and then goes to your kidney to be hydroxylated, resulting in 125 dihydroxyvitamin D or calcitriol, which is known to enhance calcium absorption. And for the longest time, that is what we only thought vitamin D does. However, recent research has shown that vitamin D is pleiotropic and has a variety of of positive beneficial effects on various health conditions. So, as you previously know, if you watched my previous video, this is natto, and natto is chock full of a vitamin known as vitamin K2. Vitamin K2 pairs very well synergistically together with vitamin D because it has a very important role in calcium homeostasis. It basically takes away the calcium that's in your arteries and puts it into the bones where it belongs. It takes out the calcium from places that it does not belong and puts it into places that it does belong. So, together with vitamin D and vitamin K2, it is also has beneficial effects on COVID, as I mentioned in my previous video, with higher vitamin K2 status leading to decreased mortality due to COVID admission to hospital. But furthermore, these two vitamins can actually interplay with both another and to impact COVID. Now, if I told anyone this right now, this would be a very big benefit because since we are experiencing the coronavirus disease pandemic right now, having something that is able to reduce the mortality and morbidity is truly an awesome thing. So, to make sure this is true, I'll actually present the data on this and see what the science and literature shows. So, first of all, for this presentation, I'll just show the biochemistry behind vitamin D in order for you to understand, and basically as we move forward to understand how vitamin D works. I'll also show you the common recommendations of vitamin D from health authorities. I'm going to be showing the health recommendations from Health Canada and Osteoporosis Canada and show how these recommendations translate to vitamin D levels in the Canadian population. Now, I'm sure that some of you watching this might actually be American in nature, and in that case, the health recommendations from Canada are very similar to America and around the world because vitamin D is not really a problem isolated to Canada alone, but rather it's a worldwide issue. Now, there's also some healthcare practitioners are afraid that vitamin D can be toxic, and I'll also show evidence that vitamin D is actually safe. So you can bring home an understanding that vitamin D is actually not as toxic as we thought. I'll also show you evidence about how vitamin D has effects that go beyond just calcium homeostasis, and they actually have effects on multiple of disease states. And in part two, I'll actually show why vitamin D is best paired with K2 for maximum efficacy, but also for maximum safety, especially in regards to COVID. So you have, I'll start off with the biochemistry regarding vitamin D. So in your skin, you have 7 dehydrocholesterol. And 7 dehydrocholesterol, when it reacts with light, which is a combination of UV light and heat, that's what sunlight is, it quickly turns into an intermediate product here and then turns into vitamin D3. Vitamin D3 is then taken up by vitamin D binding protein. Uh, and vitamin D binding protein vitamin D binding protein, and then is then transported about in the blood. Vitamin D then goes along into the liver, and in the liver it is hydroxylated into 25 hydroxy vitamin D3, and then 25 hydroxy vitamin D3 continues to flow about in the blood until it reaches the kidney. And in the kidney, it is hydroxylated once again to 125 dihydroxy vitamin D. Do not worry about this product over here. This is the important one. So 125 dihydroxyvitamin D3 is also known as calcitriol and has important effects in calcium homeostasis, principally by increasing calcium absorption in the intestine. Now, let's look at two examples for how this 125 dihydroxyvitamin D3 works. So, if you have normal plasma calcium and all of a sudden you have hypocalcemia or decreased plasma calcium, this acts as a signal to have increased amounts of PTH. And increased amounts of PTH leads to a stimulation of the kidney to make more 125 dihydroxyvitamin D3, which results in increased intestinal calcium absorption. That's where it acts. So, it acts inside your intestine in order to result in increased calcium absorption, which brings back to your normal your plasma calcium back to normal. Now, if we look at the flip side, and if we look at hypercalcemia it results if you have increased calcium from a normal state, which then acts as a signal to decrease the amount of PTH or parathyroid hormone. This acts as a signal to your kidney in order to increase enzymatic activity, with decrease enzymatic activity, which decreases the synthesis of 125 dihydroxyvitamin D3, which results in a decrease in intestinal calcium absorption, and you go back to normal plasma calcium. Now, you can see that the human body operates in a weird way because decreased plasma calcium causes increased amounts of parathyroid hormone, and increased calcium results in decreased parathyroid hormone. So, what about some of the the health recommendations for vitamin D from health authorities? Well, if you look at these recommendations from Health Canada, assuming that you're an adult between 9 to 70 years, it says that you should take 600 IU, which is the recommended dietary allowance or how much vitamin D you need in a day. And they say that the upper intake level, which is safe, and is 4,000 IU, so to not go above this value. So, what about Osteoporosis Canada? What does it say? Well, if you look at Osteoporosis Canada, it says that healthy adults between 19 to 50 years of age, including pregnant and breastfeeding women, require 400 to 1,000 units daily. Those over 50 or those younger adults at risk with osteoporosis, multiple fractures, or conditions affecting vitamin D absorption should receive 800 to 2,000 units daily. So a bit higher than the Health Canada recommendations, but they are still in around the 1,000, 2,000 unit range. So how are these health recommendations? How are they impacting the blood levels of vitamin D in Canadians? Well, two-thirds of Canadians had a 25 hydroxy vitamin D level. So remember, this is not the 125 dihydroxy vitamin D3, but the 25 hydroxy vitamin D, which is a precursor to 125 dihydroxy vitamin D, which is made inside the kidney. And so the level was 50 nanomoles per liter or 20 nanograms per mil. So nanograms per milliliter uses the American system of measurement, and the 50 nanomoles per milliliter uses the metric system measurement. Now, depending on where you are, if you're in Canada, you use nanomoles. If you're in America, you use nanograms. Now, if you want to convert between nanograms to nanomoles, you would multiply this value by 2.5. If you want to convert from nanomoles back down to nanograms, you would divide this value by 2.5. Now, the what about the other 33% of Canadians? Well, one third of Canadians had 25 hydroxy vitamin D level, much less than 50 nanomoles per milliliter or 20 nanograms per milliliter. Once again, I should reinforce that this was from Statistics Canada, so this is the official data that the vitamin D population has. Now, vitamin D deficiency is defined as less than 29 grams per milliliter. which means that most Canadians are actually on borderline value of being deficient. Vitamin D insufficiency is 21 to 29 nanograms per milliliter, and this is kind of a worldwide problem where uh, most people are either deficient or insufficient of vitamin D. It's also important to note this as we go along the rest of our presentation that you remember that on average, 1,000 units of vitamin D supplementation as D3 increases vitamin D levels, 25 hydroxy vitamin D, by 10 nanograms per milliliter or 25 nanomoles per liter. Uh, as you get up to increased dosages, uh, as you get up to increased dosages, this level starts to decrease, where increasing amounts of vitamin D supplementation increase serum plasma levels of vitamin D by a less amount than if you were at a lower vitamin D status. So, are there reasons why we shouldn't take any more? Well, the biggest reason is that vitamin D toxicity. This has been hammered into us as we were going through either a pharmacy school or medical school. And if you look at what official health recommendations are saying, this Mayo Clinic previously said, so they updated the recommendations recently, but they previously said that for caution with blood levels of 30 nanograms per milliliter, and danger if this was over 50 nanograms per milliliter or 125 nanomoles per liter. So, and recently in May 2015, they actually released an update to their recommendations, which was from one of their proceedings, and it was titled "That Vitamin D is Not as Toxic as once thought: A Historical and Up-to-Date Perspective." Now, this really shed some light on the whole vitamin D picture and kind of said that why we were afraid of vitamin D toxicity from a historical perspective, and also showed some evidence about why vitamin D is actually not as toxic as we were previously meant to believe, and gave some evidence for about how it can actually be safe in populations. So let us go further in detail in this report. So first of all, they go into that high doses were used in the 1940s and 1950s, and then for the treatment of autoimmune diseases, for example, like rheumatoid arthritis, doses of 200,000 to 300,000 daily for months and years were used. Now, if you talk to any physician and say that these kind of doses they actually gave for months and years, they would probably be astounded. And so this is the amount of dose that we actually used in 1940s and 1950s. And you can imagine that this wasn't good because this resulted in vitamin D toxicity, having such a high dose for a high amount of time. And this led to a hypercalcemia, or too much calcium in the blood, hyperphosphatemia, too much phosphate in the blood, nephrocalcinosis, which basically means that there was calcium inside the kidneys. This led to larger negative effects like kidney stones and also soft tissue calcifications as well. So, physicians were quickly able to pick up on this, and the physicians were alert to toxicity, which made them to be much more conservative on their recommendations of vitamin D that they were giving to their patients. And this idea became very well ingrained, basically in the medical community and also to health regulators, that vitamin D can be toxic. And the fact that it is a toxic fat soluble vitamin kind of still remains. I was actually taught as a pharmacy student that to be careful of how much vitamin D you also give your patients because it can actually be toxic and lead to hypercalcemia and vitamin D intoxication. So, what about some of the safety data that this report actually had? Well, in this report, it mentions one particular scientist, Studenkov. He published a paper and he looked at 20,000 vitamin D levels at the Mayo Clinic. And these blood levels were taken from 2002 to 2011. And during this time frame of 2002 to 2011, there was a 20-fold increase in people who had that dangerous amount, or over 50 nanograms per milliliter, but they did not find any toxicity. But there was one person out of these 20,000 who actually did have vitamin D toxicity. And he had a blood level of 364 nanograms per milliliter, or 910 nanomoles per liter. That is an absurdly high value. Furthermore, there was also Aquaru. Aquaru had this preventative health clinic, and he looked at 17,000 healthy patients who were taking vitamin D up to 20,000 units a day and there was no evidence of toxicity. So, since this person actually did have toxicity, this means either for one reason or another, he was taking a vitamin D dosage that was over 20,000. So the Endocrine Society also recently updated their recommendations as well and said that vitamin D intoxication happens over 150 nanograms per milliliter or 375 nanomoles per liter. This report continues to say that when does it actually occur? Well, it occurs when you take over 50,000 units or over 100,000 units for months to years. So, lo- oh, So these are some of the effects that vitamin D actually has. So it's not just limited to calcium homeostasis, but if you look at all of these different disease states, these are all the ones that are impacted by vitamin D. So let us go a little bit more to detail in this paper. So in this paper, it was vitamin D and multiple health outcomes, an umbrella review of systematic reviews and meta-analyses of observational trials and randomized trials. So what is an umbrella review? Our umbrella review kind of culminates the information from multiple meta analyses and systemic reviews. It's kind of, you can kind of think of it of an umbrella review being above meta analysis because it kind of takes multiple meta analyses and kind of tries to see, well, what does the science say about this particular topic by a culmination of a lot of different factors. So, what they used in this umbrella review was 107 systematic reviews, 74 meta-analyses of observational studies, and 87 meta-analyses of RCTs. It's basically like the culmination of all the science on a particular topic. So now, if we look at the observational the observational data that they culminated, so this is basically the same graph that I have here, except it's basically zoomed in here. But I noticed that I zoomed in here and I don't have the title, so I'll just go back to the slide here. So if you see at the very top, this is the outcome that they were looking. So they were looking at a lot of different medical conditions and to see if higher vitamin D dosage versus lower vitamin D dosage had any sort of effect on that medical condition. You could see that basically they looked at a lot of events. There are multiple studies that basically looked at each medical condition. And this is basically what they looked at. So per every 10 nanograms per milliliter. So basically higher vitamin D status versus lower vitamin D status, and this is known as the forest plot. So what the forest plot says, so how to read a forest plot. So basically, this is a line of non-significance, and if one of these lines actually touches the line of non-significance, that means that that meta-analysis was basically non-significant on this medical condition. What this means is that higher vitamin D status versus lower vitamin D status had no effect on, say, prostate cancer, for example. So, on aggressive prostate cancer, higher vitamin D status versus lower vitamin D status had no effect. It didn't increase or didn't decrease. Now, let's look at this one for example breast cancer. Breast cancer, it's on the left of the line. And if it touches uh, one, if you look at here, so for example, this one, 0.97 to 106, it touches one. So because it touches the line of non-significance, it's non-significant. However, this one does not touch the line of non-significance. It's on the left side, which means that the higher vitamin D strength or the intervention that they take actually led to a decreased amount of breast cancer. So now, if we look and to the same figure, but basically zoomed in, if you look at the first one, aggressive prostate cancer, higher vitamin D, higher vitamin D levels. Sorry, I say dosage, but I mean the vitamin D blood levels. Higher vitamin D blood levels had no effect on aggressive prostate cancer, so did not increase or decrease it. Breast cancer, this they were put in quarters, but it seems that higher vitamin D blood levels versus the lower vitamin D blood levels led to a decrease in breast cancer. For postmenopausal and premenopausal breast cancer, there was no effect of higher vitamin D dosage dose leading to higher vitamin D blood levels. For colon cancer, there was no effect because it touches the line of non-significance. Colorectal cancer seems to be reduced with higher vitamin D blood levels. Kidney cancer, there is no effect. On non-Hodgkin's lymphoma, there is no effect. For ovarian cancer, there is no effect. For pancreatic cancer, this is a weird one. It seems that with an increased vitamin D blood levels, there seems to be an increased incidence in pancreatic cancer. I'm not really sure of about the reason behind this, but vitamin D has an excellent benefit to risk ratio, where we're seeing that it has a lot of benefit on multiple disease states, and the risk is basically it's very safe, so there's negligible amount of risk, but it seems to increase pancreatic cancer. Even with this finding, the weight of benefit still seems to highly favor vitamin D. So, and now if we look at prostate cancer, there was no effect because it touches the line of non-significance. For rectal cancer, this is on the left and it does not touch the line of non-significance. So this means that the higher vitamin D treatment or the intervention arm, it basically reduced the amount of chances of rectal cancer. Now, if we look at sporadic cancer seems to reduce. Um and then the reoccurrence of the sporadic cancer, there was no effect. So higher vitamin D did not influence sporadic cancer coming back. And now, if we look at cardiovascular disease prevalence, so this is chronic cardiovascular disease, or the one that you have for a long time, and then the mortality or the death from these cardiovascular disease. It's on the left hand side and does not touch the line of non significance. So, this means that higher vitamin D blood levels did result in a reduced amount of cardiovascular disease. Uh, this is all from observational data as well. So, for hypertension, so increased vitamin D levels, there is also decreased amount of hypertension associated with higher vitamin D levels. Ischemic heart disease, with different statistics, is also decreased with higher vitamin D blood levels, and stroke is also decreased with higher vitamin D levels. Now, this figure was a little bit too big, so I actually included it on the second page as well because it did not all fit on one page. So we were just talking about stroke. So Alzheimer's disease was also decreased with higher vitamin D levels. Cognition seems to be better as well with higher vitamin D levels. Depression is kind of a weird one. Some studies say that it has no effect because it touches one. Some studies are saying that it decreases depression. For tuberculosis is highly affected by vitamin D. So higher vitamin D decreases the amount of tuberculosis, uh, uh, which is probably related to its effect on infection, which I will cover in part two of my video on how it interacts with COVID. For metabolic syndrome it seems to be decreased with higher vitamin D blood levels. Type 2 diabetes and type 2 diabetes for a while that chronically that you have also seems to be decreased with higher vitamin D blood levels. Let's see. Small for gestational age. So for babies for gestational age that are basically small, that the occurrence of that also seems to be reduced with higher vitamin D blood levels. Preeclampsia, preeclampsia is also decreased with higher vitamin D blood levels. Fracture, uh, fractures is also very significant as well, which makes sense because that is what the vitamin D is being used for right now. In postmenopausal women, we recommend calcium and vitamin D in order to increase bone mineral density in order to prevent them from having fractures and falls. And now, if we look at mortality in CKD patients or chronic kidney disease patients, it's also lower. And then, if we look at all-cause mortality, this is also lower, which is a very impressive finding that higher vitamin D levels actually decreases overall mortality, all-cause mortality, that is death due to any cause. So the people that had higher vitamin D levels compared to the lower vitamin D levels lived longer, which is a very impressive finding. Now, if we look at 125 hydroxy vitamin D, so if you remember the biochemistry of vitamin D, so it's basically travels in the blood as 25 hydroxy vitamin D, and it is then hydroxylated in the kidney to make 125 dihydroxy vitamin D3. which then acts upon the intestine in order to cause an increased calcium absorption. And this is important for calcium homeostasis. But now, if we look at 125 vitamin D for aggressive prostate cancer, breast cancer, colon cancer, and we compare it and we look at it for versus 25 vitamin D, for 125 vitamin D, these all cross the line of non-significance. So this means that 125 vitamin D does not have an effect on these states, while 25 vitamin D3 does. So this seems that the effect is so it seems that the calcium increasing effect is limited to 125 vitamin D3 or calcitriol. It seems to be that its sole function seems to be for increasing blood levels of calcium, but all these other multiple health effects seem to be connected with 25 vitamin D3, which is the precursor to 125 vitamin D3. So, 125 vitamin D3 does not seem to have an effect on these states, while this precursor, 25 vitamin D3, does. So, that's also what we measure as well. We measure your 25 vitamin D3 level, and whenever you take supplements, that also increases your 25 vitamin D level. But this report did not mention anything about infection. So how does it play on basically the role of infection, and how does K2 all factor into this? So this will all be covered in my part 2 of my video, which will be released shortly. And in that video, I'll also talk about how vitamin D and vitamin K2 should be combined together to result in ultimate efficacy and ultimate safety. So thank you for listening, and I hope you enjoyed this presentation.